Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
In a world where prevention is often more powerful than cure, the importance of timely vaccination stands as a vital responsibility for every parent. It is not just a medical decision, but a commitment to safeguarding a child's future. Yet, despite its significance, the conversation around vaccination timelines is often overlooked or misunderstood. Today, we open a discussion that every parent deserves to be part of, one that centers on awareness, trust, and informed choices. Because when it comes to a child's health, staying on time can make all the difference. So let's begin with why this matters more than we think. Welcome everyone. I'm Dr. Soumya Saluja from THIP Media, and today we address a crucial topic for every parent, the timely vaccination of children. Joining us is esteemed medical expert Dr. Kushal Agrawal, who will shed light on its importance and help answer the concerns many parents often face. Dr. Kushal Agrawal stands at the forefront of neonatal care as the head of the Department of Neonatology and Paediatrics at KVR Hospital, Kashipur, a distinguished role he fulfills with dedication and expertise. With a robust background in pediatric medicine and a passion for improving child health outcomes, Dr. Agrawal leads initiatives that shape the future of neonatal care in Uttarakhand. Armed with a stellar academic journey, Dr. Agrawal earned his medical degree from a prestigious institution, complementing it with specialized training in neonatology. His career trajectory is marked by a commitment to continuous learning and innovation, evident in his proactive approach to integrating cutting edge medical practices into patient care. Under his leadership, KVR Hospital's Neonatology and Pediatrics Department has flourished, becoming a beacon of excellence in the region. Dr. Agrawal's strategic vision extends beyond clinical excellence. He advocates for comprehensive care that addresses not only immediate medical needs but also long-term developmental outcomes for infants under his watch. Beyond his clinical duties, Dr. Agrawal is actively involved in academic pursuits, mentoring aspiring pediatricians and contributing to research that advances the field. His collaborative spirit fosters a supportive environment where medical advancements thrive, benefiting both patients and healthcare professionals alike. Dr. Agrawal's impact extends beyond the hospital walls. He is a sought after speaker at national and international conferences where he shares insights and best practices in neonatal care. His dedication to improving child health and well being has earned him the respect of peers and gratitude from the countless families whose lives he's touched. Dr. Kushal Agrawal, THIP Media welcomes you, sir.
Thank you so much.
Thank you so much for your time today, sir. Sir, we recognize that timely vaccination, is one of the most essential responsibilities in early childhood care. Yet, many parents, they find themselves uncertain or overwhelmed by the schedule, the choices, and most importantly, the timing. So, to bridge this gap and foster better understanding, let's begin our discussion with a very basic question. What exactly are these vaccines, and how do they help in strengthening a child's immune system against potentially life-threatening infectious diseases?
That's a very pertinent question. What are
Ji,
vaccines? When you know what you are dealing with, it is easier to understand and tackle them.
ji,
Vaccines are nothing but they're basically biological preparations which
ji,
stimulate the body's immune system to
ji,
recognize and fight against specific pathogens.
ji.
and at the same time, they do not cause the disease itself.
हाँ
In
जी
children, vaccines, they introduce a harmless component of a disease causing organism,
जी
which prompts our immune system to produce antibodies.
हाँ जी
This
right
immunological memory ensures that if the child is exposed to the disease in future, their body can mount a fast and prompt and effective defense, which will
जी
prevent serious illness or complications.
हाँ
So
जी
in India, these have played a crucial role in overcoming diseases like polio, measles, and diphtheria.
Anji, right, right, sir. And I'm sure there would be a very definitive classification between the ones which are mandatory for all and the ones which are specific to a certain person or an individual or a child here. So, what is the difference between mandatory or universal and optional or recommended vaccines? And why would you say that should parents be aware of and consider both the categories seriously?
Okay. So the mandatory and optional, rather,
जी,
let's not use the term optional, it's recommended.
हाँ
So
जी,
when we're talking about compulsory vaccines, they're included in the India's Universal Immunization Program, which is
हाँ जी,
UIP, and they're
जी,
provided free of cost at the government health centers.
हाँ
They
जी,
protect against diseases such as high public health impact, like
जी,
diphtheria, polio, TB, pertussis, measles, hepatitis B.
जी,
But what are recommended or the optional vaccines? These are not part of the universal immunization program, but
जी,
are recommended. I'm so sorry. They are advised by the pediatricians
जी,
and the Indian Academy of Pediatrics
हाँ जी,
because they pose significant risk to the kids regarding mortality and morbidity. So the
जी,
question is that why consider both?
हाँ जी,
It is because while the mandatory vaccines they address the diseases which hold national priority,
जी,
but optional vaccines protect against additional infections also, which
हाँ जी,
cause significant mortality, sorry to say is death, and
हम्म,
morbidity is not allowing the kid to live their life to the fullest.
जी,
So
जी,
informed parents can make better decisions for the comprehensive protection for their own kid.
जी, जी. So what we understand here is that vaccines, they are helpful both at community level or the national level and of course the individual level. Right? Right. Okay. Now you've given us a very long list of vaccines that are, recommended for kids. But I'm sure there would be a specific age, for the administration of these vaccines. So, on what scientific basis do healthcare providers like yourself determine the specific ages and intervals for administering each vaccine in children?
Correct. So this is a very a specific question in the sense that when
Ji,
we try to explain it to the parents, they feel I don't know, doctor is giving it as per their own convenience, and
ji,
it's as per their own whims and fancies. Someone is saying, "Hey, come at this time," someone is saying, "Come at that time."
ji,
No, we're not working on our own whims and fancies. They're very robust and comprehensive data-driven analysis and evidence and research which has gone behind it. So, what are
ji,
the points which are considered while making this program?
ji.
First, we have to look at the age-specific risk.
हाँ
There are
जी,
certain diseases which hold more significance at a younger age. For example, like right at birth, there'll be a provision for hepatitis B and polio drops.
जी,
Also, we have to factor into the immunological maturity, the
जी,
body's ability to respond effectively at different ages.
जी,
Then there is epidemiological data. For example, that all the vaccines, even in universal immunization program, they vary
जी,
as per the area.
जी,
I mean, there can be an area where there is more prevalence of Japanese encephalitis.
जी,
So there, Japanese encephalitis vaccine will be there in the universal immunization program.
जी,
But the
जी,
area where it is seen that it is not that big a risk, not of a priority, it will not be offered
जी,
to the
जी,
parents.
जी,
And then at the end, there is lot of vaccine efficacy and clinical trials which are done, which determine the optimal timings for the maximum protection. So
जी,
Ministry of Health and IIP, they regularly update their schedules based on the global and local evidences.
जी, जी, sir. So that is why, just because kids are more vulnerable to a particular condition at, different milestones in their life while they're growing. So, following a vaccination schedule is very important here. Like, and what if a scheduled vaccine dose is missed? So, what actions should a parent take? And can the child resume where they left off? Or is a new plan required in such cases?
Okay. See, first of all, if a dose is missed, don't beat yourself up.
Okay,
No dose goes wasted.
right,
If vaccine has been given, it is going to help your kid, no
right.
matter what. All right.
Hanji,
So first of all,
hanji,
you have to get out of the guilt trap, and then at times, this guilt trap leads to decision paralysis and avoidance.
hanji.
Okay, so don't do that. Contact the pediatrician as soon as possible. We will make sure that we resume the missed doses as per the guidelines. There is a whole set of guidelines regarding catch-up vaccinations also.
Ji,
We as doctors and the people who are doing the research, we
ji,
understand the practicalities of every single
hanji,
thing. So there
hanji,
is a different schedule regarding missed vaccines also. So don't worry, your kid will be well cared for,
ji,
and just don't delay things,
hanji.
and don't uh, go to the doctor as late as possible. Come as early as possible, it will be way better.
जी, सिंपल सी बात है, अगर आप भूल गए हो तो जस्ट टेल योर डॉक्टर एंड दे हैव ऑल द कैच अप शेड्यूल्स फॉर द मिस्ड वैक्सीन्स हियर, राइट? तो
Exactly.
अभी थोड़ा सा उन्हीं बैरियर्स पे ही काम करते हैं कि अगर मिस हुआ भी है तो क्यों हुआ है. सो व्हाट आर द मोस्ट कॉमन बैरियर्स टू टाइमली वैक्सीनेशन? एंड आई एम आस्किंग इन टर्म्स ऑफ, लेट्स से, फाइनेंशियल, logistical, or informational, and what community or healthcare resources, can help overcome them.
Okay, so basically the barriers, they are financial.
जी,
Financial in the sense that obviously, but they're costly.
हाँ जी,
Also, you have to take into account the logistical and the financial together. The person
हाँ जी,
has to travel to a certain
हाँ
area
जी, हाँ जी,
to get the vaccination done.
जी,
They have to take leaves. They have to
हाँ
take
जी,
taken off from their
जी,
work, and at times it's informational. They think that it is not important. What they feel is, for example, natural immunity is better than your vaccine immunity. There are a lot
vaccine.
of
Hmm.
misinformation which is there. So
जी,
regarding these constraints, what you should be doing is that financial constraints are therefore optional. The recommended vaccines, at least get
हाँ
the
जी,
universal vaccinations done. The lack of
जी,
awareness and the misinformation, the distances, they are causing a lot of challenges, especially right now the monsoon season has started. So
जी,
the logistical issue of reaching the centers and
hmm,
the missed opportunities during the clinical visit. Parents,
जी,
when they go for regular clinical visits, I mean, your khasi, jukham, bukhar, to the
हाँ जी,
pediatrician, they at times do not ask them that should we do something? Is there any vaccine left?
okay, right,
Right.
right,
And misinformation is there online. I mean, I think every single sphere today talks about misinformation on online.
जी, बिल्कुल, ये है,
So the resources which are there, see, the government is doing a lot. It has provided free of cost vaccination to reduce the financial challenges, to reduce the logistical challenges. They have reached the ASHA and the Anganwadi workers who go door to door campaigning regarding the
yes,
vaccination. To
yes,
reduce the misinformation, the ASHAs and the Anganwadi workers, they have to ensure that they provide proper information to the parents that this is the vaccination which is due, why should you get it done. Also, they're
right,
running mobile vaccination camps from the government
right,
side. The
right,
government immunization centers have been set up, which are providing
right,
free of cost vaccinations. And for the proper information, we have got, you can use digital reminders on the CoWIN app, or you can put SMS alerts.
right, right, sir. And now again, coming back to the topic where parents would miss this vaccine, or they may just consider that it's not required, दो लगवा लिया, तीन लगवा लिया, हो गया, अब और नहीं चाहिए. तो ऐसे cases में, what specific health risks or complications can arise in children when essential vaccines are delayed or missed altogether?
Okay. So it's not just essential vaccines, even the recommended ones. We
जी,
got typhoid vaccine, which is in the recommended. So
जी,
typhoid, all of us know that it's a very important
yes,
public health risk
जी,
factor right now.
हाँ
So
जी,
what happens is that we run the risk of contracting vaccine preventable diseases. Imagine things
जी,
like measles, polio, diphtheria. We run the
हाँ
risk
जी,
of contracting them. We run the risks of contracting severe complications like
okay,
pneumonia. Pneumonia, you can understand the infection of the lung.
yes,
Encephalitis, infection of the
yes,
brain.
right,
Paralysis, your body
okay,
stops working. So these are the
yes,
complications of these diseases. So if you
mm-hmm.
don't get your vaccinations done, you run the risk of these complications too. You
Right,
also prevent the outbreaks in the community. You have to understand there's a
right,
herd immunity which is at play.
yes,
Okay, so you might have heard of this concept during COVID vaccination and corona. What happens is that in herd immunity, even despite our best intentions and the best execution, we will not be able to cover 100% of the vulnerable population. So
right,
what we do is we cover as many as possible, and they work in the way they isolate the susceptible individuals and
right,
prevent the transmission. So the
right,
herd immunity works in a huge way in preventing the outbreaks. And
right,
of course, I mean, it's a painful thing to say, but increased mortality, there's increased death rate
right.
if you miss the vaccine doses completely and do not participate in vaccinations.
Okay, right, right. And now I'm going to come from somebody who's just about to begin their school life. You know, kids' school play a very important role in their lives. It's a very important part and a very long aspect of their life while they're growing up and they're developing, making friends, and of course, the academic pursuance there. So, what role does timely vaccination play in ensuring a school-going child remains healthy, learns without interruption, and avoids outbreaks in educational settings?
Okay. See, timely vaccinations, how they help the school children is they prevent the disease outbreaks in the schools itself.
Ji,
They also protect the vulnerable classmates, like we said
ji,
about herd immunity. You will
हाँ जी,
not be able to cover the 100% of the kids. But
जी,
if you're vaccinated the majority of the kids in the class, then you will be
हाँ
able
जी,
to actually protect the vulnerable population also who
हाँ
might not
जी,
be getting vaccination due to unavoidable circumstances.
जी, जी,
So also there is reduced absenteeism due to illnesses. So the
हाँ
kids
जी,
can enjoy the school even more. They can play with their
जी,
classmates and they
जी,
can have a lot of fun. And of course, I mean, that goes more for the parents and the teacher rather than the kids, but ensures an uninterrupted learning and development. You
जी,
have to also realize that because it is so important, majority of the schools they insist on vaccination records at the time of admission, which
जी.
underscores its importance in its own right.
Handsome. Right, sir. And now coming on to how parents can actually, maintain the vaccination record of their children. So how can they efficiently manage, their child's vaccination records and schedules? Like you just said that, while the child is being admitted to a school, a proper vaccination regimen, it plays a very important role. It actually underscores not only their own safety, but also their classmates' safety. So, when especially and of course, there might be parents who are traveling across the country. So it is very important for them to maintain such records, when they are consulting multiple doctors. So how would you help such parents manage their child's vaccination records?
Okay. See, it happens so frequently during the summer breaks because
Ji,
it is a very common uh, custom which is there that during the summer breaks, the girls, the wives, they go back to their maternal home. The kids
Hanji,
go. So generally, at times, it extends up to 15 days to 1 month. So
Ji,
that was a frequent issue which comes up.
Ji,
It's very easy. See, first of all, just make sure that whenever you get the vaccination done, you have a physical document of it.
Ji,
Majority of the pediatricians,
Hanji,
barring, and I really think barring anyone, all the pediatricians, they ensure that they give a vaccination card.
Ji,
Second, they ensure that whenever a vaccine has been given, they make a record of it in the card itself.
जी.
Third, the good practices which are followed by majority of the pediatricians is that if someone comes to them with a pediatric chart or the card of somewhere else, they
जी.
try to update the same one.
Okay.
They
Right.
don't try to confuse the parents with multiple cards.
जी.
As far as possible, they try to update it on the same card itself.
Okay. Right. Right. Uh,
So this is
Right.
about the physical cards.
हाँ जी.
Second, the mothers and the fathers. I mean, this is a two-way
जी.
responsibility. They should
हाँ जी.
always take as many photos as possible. Use the cloud to store the
हाँ जी.
important documents. And whenever they are relocating or going to some place, do contact the local healthcare provider.
Mm-hmm.
And if they meet them for some other issues, like some illness, some cough, cold, flu, anything of that, do discuss the vaccination schedule, the coverage with the healthcare provider every single time.
जी. जी, sir. So I think it's the parent who should be more vigilant, and they will actually have to allow the doctor to help them maintaining a good vaccination record. Wonderfully put, sir. Okay, now just mention that there are people you've come across who believe that the natural immunity is way more superior than the ones which have been programmed in the body by the vaccinations. So, sir, what are some prevalent myths or misinformation about childhood vaccination that you have come across apart from this, and how can parents, identify and rely on accurate and science-based information?
All right. So there was this one massive myth which is still prevalent that vaccines cause autism. It has
Right.
had no scientific evidence whatsoever.
Ji.
Then there's a myth that it affects the fertility at some level. Okay, so
Yes.
that has no scientific basis whatsoever. Next,
Ji.
when we're talking about natural immunity is better than vaccine-induced immunity, I'll just say the same thing which I tell my parents, which the parents who come for with this query. I always tell them that if you're driving a car, you don't have to be in a car accident to realize the importance of seat belts.
हाँ जी.
So, in the same way, the body does not need to go through the traumatic experience of the disease
जी.
to mount its own immunity.
हाँ जी. हाँ जी.
Okay?
Right.
And then the next common myth is that vaccines are unnecessary, they're unsafe if the diseases are rare. Diseases are
Right.
rare, all right, but even if they happen once in 100 babies, and if your baby is that one, for you, it's 100% risk.
Yes.
So when we're talking about how to identify authentic, accurate informations, first of all, there are reliable government websites, Ministry of Family and Health Welfare. There are reliable
जी.
Indian Academy of Pediatric guidelines which are available online.
जी.
You can
जी.
consult qualified pediatricians. You
जी.
can avoid unverified social media claims. And
जी.
I'll recommend again, listen to your
जी.
interviews.
Okay. Right. Right, sir. अभी थोड़ा सा ही extension of the health literacy that you've given a long list again, that we have reliable government websites, we have well qualified pediatricians like yourself. So how does health literacy influence a parent's ability to make informed decisions about vaccinations? And what steps would you suggest, that they can take to strengthen their understanding?
Okay. See, higher health literacy. It helps the parents to understand the vaccine benefits and their effects. They're able
जी.
to understand what is the uh, priority and the schedules. Why is it
हाँ जी.
important? What is
हाँ जी.
the importance of following a proper schedule which the doctor has recommended? They're able to
जी.
recognize the misinformations better. They're able
हाँ
to
जी.
make timely and informed decisions also. So,
जी.
parents' education background goes a long way in helping us in achieving proper vaccination coverage. See,
हाँ
the
जी.
way they can improve this is they can attend community health benefit talks, they can read the government health pamphlet, they can
हाँ जी.
ask questions during the doctor's visits. Like I've said previously, that if they're
जी.
going visiting the doctor for some other issue, always discuss the vaccinations so
हाँ
that they
जी.
can remain up to date and use trusted online resources only.
Okay. And what about the ones who are not educated? We have a very good group of people who are not educated as well. So any advice for such parents?
Trust the government.
Okay.
The Universal Immunization Program is providing free of cost vaccination against 12 plus diseases at government
Ji,
center. They're
ji,
ensuring that it is getting adequate coverage in the rural and the underserved areas.
ji,
They're
ji.
ensuring that they have ASHAs workers, they have mobile camps, they're running awareness campaigns. So
जी,
listen to them. Don't think कि ये तो कलयुग आ गया है एंड
हाँ
ये
जी,
जो मेरे बेनिफिट के लिए बता रहे हैं इनमें तो इनका कोई स्वार्थ होने वाला है, नहीं होने वाला।
नहीं होने वाला। आप ही का बेनिफिट है। अगर आप अपने प्राइमरी हेल्थ केयर सेंटर्स में आशा वर्कर्स को कांटेक्ट कर लें तो नथिंग लाइक इट। तो आई थिंक बाय द टाइम द चाइल्ड इज बोर्न दे कैन ऑलवेज कांटेक्ट द आशा वर्कर और द आंगनवाड़ी वर्कर एंड दे कैन हेल्प देम, रीच
Yeah.
आउट टू द आउटलेट वेयर द वैक्सीन वुड बी गिवन टू द बेबी। राइट। एंड सर, अभी आपने हमें बहुत अच्छे से समझाया कि बहुत सारी गवर्नमेंट साइट्स हैं जो रूरल एरियाज में भी हेल्प कर रही हैं, जो अर्बन एरियाज में भी पेरेंट्स को हेल्प कर रही हैं। तो आप ऐसी कुछ रिलायबल गवर्नमेंट वेबसाइट्स के बारे में भी हमें बताइए जो थोड़ी एक्यूरेट हैं, वो रेगुलरली अपडेट कर रही हैं वैक्सीनेशन गाइडलाइंस को फॉर पेरेंट्स, क्योंकि कलयुग तो है बट उसके साथ साथ एक प्रॉब्लम और भी है कि डिजीजेस भी बढ़ते जा रहे हैं। सो आई थिंक अपडेशन इज वेरी इंपॉर्टेंट हियर। प्लीज सर।
So we have the Ministry of Health and Family Welfare that
जी,
you can write on www.mohfw.gov.in. Then
जी,
you have a national health portal,
जी,
nhp.gov.in.
जी,
Then you have Indian Academy of Pediatrics,
हाँ जी, हाँ जी,
iapindia.org.
जी,
Then you have the Cowin portal, COWIN, the Cowin, gov.in portal.
हाँ
So
जी,
these are up to date. They ensure that timely and trusted resources are available for the parents at their fingertips.
Ji, ji, sir. And I'm just going to summarize this wonderful session with the one final question to the Bhulakkar parents and the ones who are very busy. उन्हीं के लिए है बस कि the ones who have fallen behind on their child's vaccination schedule, sir. What is a comprehensive to-do list they can follow to catch up and ensure timely vaccinations in the future?
Right. So first of all, consult the pediatrician immediately. We are not going to judge you.
Ji,
We completely understand the realities of life.
ji,
Next, bring all the existing vaccination reports, whichever you have.
ji,
Follow the catch-up guidelines strictly.
ji,
Set reminders. You have got
हाँ जी,
your phone, you've got apps, you've got SMSs for
हाँ जी,
upcoming doses.
हाँ जी,
Attend all follow-up appointments.
जी,
Update your records after each vaccination.
right,
Educate yourself regarding the importance of timely vaccinations and
जी.
inform the schools also regarding the updated vaccination status.
Ji, sir. And on that beautiful note, I really appreciate your presence with us today, sir. And I'm hoping that the enlightening information shared will be valuable to many families and will save a lot of lives. Thank you so much for joining us. It's really been a pleasure.
My thank you so much. My pleasure. Complete.
Thank you so much, sir. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.
Thank you.